Hi, this is Dr. Jin Sung, and welcome back to Thyroid Success Secrets number 12, Brain Function. Brain function is extremely important in managing thyroid conditions. As I mentioned previously in our previous videos, the brain controls every bodily function. Your pituitary drives the thyroid gland. It releases TSH. The part of your brain called the hypothalamus drives your pituitary, affecting TSH. Our brain needs two things to survive: fuel and activation. Fuel is basically glucose and oxygen. We have addressed the glucose end in the previous video. Now let's address the importance of oxygen. As you age, your ability to utilize oxygen decreases by 1% per year after the age of 25. I mean, how many athletes have you seen in their 50s performing at a high level? Most of the athletes performing at a high level are in their 20s and maybe early 30s. So if you're 50 years old, you've lost 25% of your ability to use oxygen in your body. This is called oxidative phosphorylation, which is a big fancy term meaning that you're not utilizing your oxygen as well as you did when you were younger. Secondly, the neurotransmitter serotonin plays a major role in thyroid function. There's a place in your brain called the hypothalamus, which controls the pituitary to a certain extent. And there's something called the periventricular nucleus that lies in the hypothalamus. I know these are big fancy words, but it's critical for you to know this if you're going to understand why you're suffering from thyroid symptoms. Serotonin acts on the hypothalamic periventricular nucleus in the central nervous system, or the brain. And what it will do is make you have low thyroid stimulating hormone, or low TSH. Low TSH can also result in hypothyroid symptoms. Taking thyroid hormones for these problems is not going to do anything for you, is most likely going to make your symptoms worse. Don't get me wrong, I'm not telling you to stop your medications, right? That would be wrong. But you need to be aware of the fact of what's happening in your body. I'm saying be aware of what's happening to your body, because once you start asking your medical doctors why you're taking these medications, they're going to look at you like you're crazy, like you have a psychosomatic illness, which means to them your head needs help, and they're going to prescribe you an antidepressant rather than address the underlying issues. The biggest influence in serotonin is blood sugar. That's why we addressed glucose in our previous Thyroid Success Secrets number 11. So if you haven't watched it, please go back and watch that video. So if you're hypoglycemic, or low blood sugar, or insulin resistance, or high blood sugar, or even diabetic, it is vitally important that you maintain your blood sugar levels within the optimal range of 85 to 99. This is why it's so important to eat healthy. Don't skip meals. Quit eating the junk food. Americans have a big cup of Dunkin' Donuts coffee and a donut for breakfast. You're just setting yourself for a bad day and then eventually bad health. Every time you eat junk food, you are literally eating away at your thyroid gland. You're making your problem worse. By consuming poor junk food filled diet, you will increase your thyroid symptoms: feeling tired or sluggish, inability to lose weight, cold hands and feet, insomnia. You will gain weight easily. You will be unable to lose the weight. You'll have difficult or infrequent bowel movements. You'll be depressed, have a lack of motivation. You'll have morning headaches that wear off throughout the day. The outer third of your eyebrows are going to get thin. Your skin and your scalp will get dry. You have mental sluggishness, nervousness. You can become emotional. You have night sweats. There are so many symptoms that can occur because of low thyroid function. You have all these symptoms, yet your labs are considered normal in the traditional medical view. Remember, those labs need to be put into an optimal or functional range and inspected carefully to discover where your nutritional needs are. Again, my name is Dr. Jin Sung, where clinical excellence meets excellent results.